Tuberculosis is basically infection of the lungs, which we call pulmonary tuberculosis. But tuberculosis can also affect other organs like the bones, the brains, and blood, which we call miliary tuberculosis. And also, it can affect the other genital organs, the ovaries, the uterus, and also the kidneys, which we call genitourinary TB. Tuberculosis in general is an infection of the body by the bacteria of the tuberculosis, that is the Mycobacterium tuberculosis, and commonly most cases it causes infection of the lungs, which we commonly known as pneumonia. Pulmonary tuberculosis is the most common form of tuberculosis. Also, it can lead to accumulation of water in the lungs, which is known as pleural effusion. So pleural tuberculosis and pulmonary tuberculosis are most common forms of tuberculosis which we encounter, and it is caused due to the infection of a certain kind of bacteria called Mycobacterium tuberculosis. Tuberculous pneumonia is the same thing as bacterial pneumonia, and the same group of people, that is those who have immunocompromised state, that is diabetes, or those who are having any lung malignancy or any other malignancy of any part of the body, those who are taking steroids or other immunomodulatory drugs which reduce the immunity, and those who are having organ transplantation or any implants or any artificial prosthesis in their body, they are at more risk of developing this pneumonia. Also, those who are heavy smokers and drinkers, they are also more prone to develop pneumonia, particularly the tubercular pneumonia. Tuberculosis in the lungs has the same signs and symptoms as pneumonia. That is, they have fever, they have chest pain, they have cough with sputum, and at times they cough out blood. That is, hemoptysis is present, and also they might have wheeze and shortness of breath accompanying it. And tuberculosis, if there is accumulation of water in the lungs due to tuberculosis, then the chest pain and shortness of breath will be very severe. Also, if tuberculosis affects other organs like the kidneys or the genital systems, then it can cause pain in the abdomen, irregular urine passing or passing of blood with urine, and the abdomen may swell up and there may be water in abdominal TB. So a variety, and in cases of bone also, if there is tuberculosis of the bones, especially the spine, then there may be back pain and weakness all over the body. So it depends mainly on whether tuberculosis has infected, whether tuberculosis bacteria has infected. Most commonly in the lungs, we get infection and signs of pneumonia, that is fever and coughing out of blood. So one has to be particularly aware that if these symptoms are present, then tuberculosis may be a common cause, because in India, tuberculosis is the most common cause of pneumonia throughout. Tuberculosis is diagnosed with the help of mainly a sputum examination, which we call sputum for acid-fast bacillus and ZN stain. This sputum examination is done in most of the diagnostic laboratories as well as the government hospitals, where in the outdoor, you can, in the chest outdoor mainly, you can go and get your sputum examination done. Also, sputum for the NAT, the nucleic acid amplification, is a very common test which is being done nowadays to diagnose tuberculosis. Blood tests are also useful in aiding the diagnosis of tuberculosis. If we have a raised count or raised ESR, the erythrocyte sedimentation is raised. Also, chest X-ray with a cavity, it may help us identify whether TB is present or not, and we confirm it again with a sputum examination. And also, there's a blood test, as I said earlier, that IGRA, interferon gamma release assay. So this blood test helps to also confirm whether tuberculosis infection is present in the body or not. So mainly the sputum examination, the blood examination, chest X-ray, CT scan if required, and the interferon gamma release assay. These help to confirm tuberculosis, particularly of the lungs, and also in other parts of the body. Any of the body fluids which we aspirate, like in bone spinal TB, we aspirate the cerebrospinal fluid from the back, or in cases of genitourinary or abdominal tuberculosis, we aspirate if any fluid collection is present or not, or take a biopsy from there and subject it to the nucleic acid amplification test. Then we can diagnose tuberculosis in those methods. Commonly, we have to look for the common causes, that is pulmonary TB. And in case of pulmonary TB, sputum, chest X-ray, and blood are most important in diagnosing tuberculosis. Treatment for tuberculosis is mainly the anti-tubercular drugs. There are four anti-tubercular drugs which are given in the form of tablets by the government. And also in private setup, you get treatment for tuberculosis. But right now, the government has provided a robust infrastructure for diagnosing and treatment of tuberculosis. So these drugs are available in the market free of cost if you follow government protocol. And normally it takes around 6 months to treat normal tuberculosis, and drug resistant tuberculosis takes more time and requires more medicine, which can be diagnosed with the help of the nucleic acid amplification test. So apart from these medicines, normal like if the patient has any fever, normal anti-pyretic medications and proper fluids hydration, these are also very important in treatment of TB. And stoppage of any addiction like smoking or alcohol. This is also very important for treatment of tuberculosis, and correction of comorbidities such as any diabetes which is uncontrolled. You need to control the diabetes properly, have proper food, take proper rest, and maintain sanitation, hand washing, and wear masks throughout. So these are some of the protocols that we need to follow while treatment of tuberculosis. So not only we are treated, but we also prevent spread to the community. Tuberculosis has many complications. One of the main complications is accumulation of fluid or water in the lungs. So this is called pleural effusion. In this case, it is an emergency, and you need to rush to the general physician or chest specialist who is nearby and get it treated. It mainly involves removal of water from the lungs. Also, another very common complication is coughing out of blood. Lot of blood may be coming with the sputum, which is called hemoptysis, and it needs to be treated in an emergency by the physician or chest specialist who is present there. Also, you may get other complications like pneumothorax, where air may enter into the lung, or hydropneumothorax, where air and water both may be present in the diseased lung. These are emergencies and need to be treated immediately with an operation where a tube may be inserted to remove the air in the lungs. So, in order to prevent all these complications, we have to ensure that the medicine is being taken properly. Patient is practicing all the good lifestyle procedures like not having any alcohol or not smoking, and eating proper food and maintaining diet, and also ensuring that the patient does not pass on the disease to the others. So if the medication is being properly taken and the patient is practicing good lifestyle, then we can ensure that yes, the complications of TB won't be happening in the community.